name's Seth Ullian. I'm the physician assistant who works with Dr. Chung. I've worked with him for almost 15 years. About 7 years ago now, he did an ACDF, which is an anterior cervical discectomy infusion at C5 to C7 for me, because I was starting to have neurological symptoms because I had pretty severe cord compression just congenitally, and my hands were starting to shake. And since I operate for a living, that was a problem. And I was getting some myelopathic symptoms, which are the symptoms that occur when your spinal cord's being squeezed. We got an MRI and it was pretty ugly, and I was like, I think I need to fix this because otherwise I would have to change careers. So we went and did an ACDF. Somebody else had to assist him because I was on the table. So I've had zero issues ever since surgery. I've recovered all my function, and I'm strong in my upper body and pretty well coordinated. So everything went really well for me. He's an extremely meticulous surgeon. He's pretty inflappable. So things happen in surgery. There's anatomic variations. There's all sorts of things that you have to deal with, especially in this market. We have a lot of older patients, and people have all kinds of things that maybe you don't necessarily know you're going to run into. And he's always very calm and very measured when he takes in the situation, takes a beat, decides the best course of action, very sort of calmly addresses it. He doesn't, he's not a get angry in the operating room kind of guy. He's very well respected by everybody. We do trauma. We've done trauma for years. So he's the guy that if you come into the operating, or if you come into through the emergency department or the trauma department, and he happens to be the one on call, everyone, the trauma staff likes to tell the patients, "Oh, you're lucky. You're in good hands." He's a good guy. I mean, we worked together for a long time because we have good chemistry, professionally and personally. So I really think he, always puts the patient first, and I don't know if that's as common in medicine as it used to be.